ready.
Okay.
Okay, hello everyone. I'm Jada Smith. This is my Capstone project, my senior project for nursing, and we had to do a evidence-based practice topic. So I chose health-associated infections. Since we're in long term, I felt that was appropriate.
It's kind of blurry.
Can you see it? Oh my gosh. Okay, so basically it's going to be about health-associated infections. Generally, they develop after you come in contact with the healthcare system. Common ones are, of course, the catheter-associated infections, CAUTI, surgical site infections that could include CLABSI as well with the inline catheters, bloodstream infections, pneumonia, and C. diff. So on this project, my whole main goal was to come up with an idea of how to prevent some of this from happening and keep the costs down, because I know it costs hospitals a lot of money to correct these issues. So, health-associated infections caused by bacteria, viruses, fungi, parasites, and they can be transmitted via contact, airborne, or droplet, and they are costly. They can cost the patients their life and cost the healthcare industry lots of dollars. So the objectives for this would be to increase the efforts of preventing the HAIs and also increase awareness to infection control, education, make sure everyone has the appropriate techniques for performing these procedures, and keep this cost down. So my rationale would be, like I said, to bring awareness. They decrease patient outcomes if patients get sick.
That's his thing.
According to the CDC, about one out of every 25 patients they will acquire an infection while receiving hospital care. And recent studies show that by implementing the preventative measures, we'll save about $25 billion in medical cost savings. So prevention is cheaper than to try to fix it after it's already occurred. And these are just some things that we work with here. Central lines, Foley's, which are the two of the biggest ones right now that everybody's trying to get in front of. So I felt like this hospital would benefit because our patients are here for a long term, and a lot of them come in with these type catheters. Of course, we all know hand washing is proven to be the #1 way to prevent the spread of infection. And just a tip for hand washing: make sure you remove all jewelry, pre-wet your hands. Use soap and lather for about 15 seconds and rinse. A lot of people say sing the happy birthday song, ABC twice. Just some tips to help you know how long to wash your hands. Just some tips on PPE. We should use standard precautions with every patient, not just the ones we think may have some type of infection. Everyone should fall under this umbrella. These are some best practices for prevention I actually learned here through HelpStream. Hand hygiene, of course, before and after contact with the patient. I say not just the patient, with anything you touch in their room, just so you don't take it to the next room. Environmental hygiene, that comes with housekeeping. Make sure they're educated on how to clean. Make sure there's no visibly soil surfaces. Make sure they dispose of the laundry properly. Any invasive procedures, keep those sterile. antibiotic use. Avoid antibiotic use, overuse, because if they get too much antibiotics, then when it's time to get more antibiotics, it will have a hard time fighting whatever the infection is. Of course, bloodborne pathogens like HIV, hepatitis, airborne. We already have our employees wear masks if they don't have the flu shot. Influenza is one of the airborne precautions. Contact precautions, droplet PPE. Always make sure you use appropriate PPE when needed. And then our personal responsibility, just stay home if you're sick. Don't come to work and get other people sick, get your patients sick. We have to do a PICO question. And the question I based this project on was, in the hospital setting, how effective is quarterly skills clinics versus a week-long orientation when you're preparing staff to appropriately perform procedures to prevent the healthcare-associated infections? So basically, ongoing education instead of just when you get hired and go through that initial orientation. So the evidence would be, basically, you see people have lengthier illnesses, higher medical bills, and greater risk of death. So those are the evidence we know that's in place already that constitutes a change. So my recommendations, again, would be more education and training. I've done one here before, which was good. I felt better refreshing my skills. And I would recommend that the resources be set aside for the extra refresher courses. And studies show, analysis of the material shows that proper education of the staff, including development of the right hygiene and epidemiological habits, can greatly help the adherence of aseptic standards. So we will have a skills clinic for all the nurses and support staff quarterly, a station for capital placement, dressing changes, central line changes, appropriate PPE, dress in and out, and hand washing. And then have the management do weekly observations, just pop in on a nurse or a tech performing any of the skills just to see if they're doing it appropriately and document, and that way we can present it later to see if our infections are down. So if all goes well, the evaluation would be we will have decrease in the number, of course, of HAIs, and we will also have decrease in the cost for the hospital. Patient outcomes will be better, and we can incorporate everything spent that you treating it with, then use that towards supplies and to help with the skills clinics. You could also just use expired stuff if you're just practicing, and that can save on costs as well, instead of buying all new equipment. So our customer satisfaction will go up and our costs will go down. That will be the expected outcome of the project. Just some stats on off the CDC website to kind of show how it's decreased in recent years, but it's small amounts, so that lets us know it's still work to be done. It's only about a 7% decrease in cavity, and I know we still use a lot of Foley catheters, so this was in 2015, 2016, and I know everybody's kind of been on the wave of trying to prevent those infections. Cloudy and capsule are like the biggest ones. Ventilators, and we don't really use ventilators here, but those are just some of the top ones, and I feel like it's still, we can get those numbers better. So education, basically education is key. Just like we educate our patients, we need to continue to educate our staff. Especially if you don't use a skill every day, it's easy to lose. So basically just keep on practicing, keep on educating. And those are my references. And that concludes this presentation.
Very good.